healthcare is broken, and this is not a reserve of third world countries like Kenya. I think even in European countries, they do face challenges.
The Roots of the Science podcast with your girl, Anne with an E.
Hello, everyone, and welcome back to another episode of Rooted in Health 2, the podcast series in collaboration with Global Health Strategies. As always, I'm your host, Anne Chisa, and thank you for tuning into this episode. If you are a regular or a newbie, remember to subscribe, disseminate the show, and definitely like. Now, let's get into today's episode. Imagine needing to walk 50 kilometers just to see a doctor. Now, imagine getting treated from your phone. Today's episode is the story of Kenya's TIBU Health. In Kenya, there's just one doctor for every 5,000 people, far below the recommended World Health Organization standard. And that challenge is only expected to grow as climate change drives up cases of malaria, cholera, and infectious diseases like TB. At the recently concluded Africa Climate Summit, digital health emerged as a key solution for building climate-resilient health systems. Layer onto this another stark reality. A recent report by the Ministry of Health in Kenya showed that 93% of Kenya's health facilities cannot provide even the most basic outpatient services. This is the case of many African countries, not Kenya alone. Add long queues, high costs, and severe workforce shortages, and you begin to see the urgency for innovation. TIBU Health is rewriting the story. By blending in-person services with digital solutions, this pioneering platform is bringing affordable, patient-centered healthcare directly to the people, whether through a phone, a mobile clinic, or at home. At the center of this movement is today's guest, Dr. Karl Daniel, a healthcare leader passionate about creating systems that truly serve communities. In this conversation with Dr. Karl, we'll explore how TIBU Health is breaking down barriers, leveraging technology, and showing the world that Africa can lead in building healthcare for the future. Now, let's take a listen. Hello, Dr. Karl. Welcome to the show.
Thank you, Anne, and thanks for having me on this show.
It is such a pleasure to have you on. Would you kindly briefly introduce yourself for our audience before we get started in the work that you do?
Thank you, Anne. My name is Dr. Karl Daniel Lodiaga. I'm a medical doctor by profession, specialized in epidemiology. I'm also a healthcare executive and entrepreneur, currently based in Nairobi, Kenya.
Fantastic. So today, Dr. Karl, we're going to be talking a lot about TIBU Health, and I can see it prominently seen in your background. We're going to be talking about Kenya's healthcare system and everything. So I just wanted us to contextualize our conversation, right? To begin with, would you kindly paint us a picture of what healthcare looked like or currently still looks like for the average Kenyan before TIBU Health came into the story?
Okay, so I always start by saying healthcare is broken, and this is not a reserve of third world countries like Kenya. I think even in European countries, they do face challenges, and the major challenge actually is access to healthcare. And when people talk about access to healthcare, I think they always think about the underprivileged, low middle income, but they forget that even the working class and let me call them the middle class, also face challenges because if you walk into Nairobi Hospital today or Aga Khan, for example, it might take you between 4 hours, and sometimes you even have to wait a day or two to see a specialist. So healthcare access is quite a challenge to everyone. And I think TIBU Health is one of the pioneers that is trying to transform healthcare in Kenya. We started this process during COVID times, and I think we did a lot of amazing things during that time, and we're still doing so. So we are transforming healthcare as you know it.
Yes, fantastic. I absolutely love that. And I like what you said that, the issue of accessibility to healthcare is an issue that everybody faces because we always center it to be an issue that only people in low income or vulnerable areas are affected by. But every single person is affected by the long lines, by the long waits. That's something that you cannot get around. So when you saw this reality, what then inspired this vision for TIBU Health?
So around COVID times, there were many challenges because I think, as we noted, that the healthcare system wasn't ready for
Mm.
that kind of pandemic situation. I also think things like Ebola, we are lucky that they have not reached Kenya, for example, because we are not completely ready for such. And I think during COVID time, it was a testing ground for us. For example, I can say during that time, my mom was just diagnosed with cancer, and it was a challenge to seek healthcare. As much as you had money in your pocket, even leaving the country was a problem. And for that instance, we had to rethink the way we deliver healthcare to the community. Is it always important or a requirement to have all healthcare diagnostics and treatment to be done inpatient, or are there certain services that can be delivered at home, at the comfort of your home or the comfort of your office? And I think COVID times challenged us to accept teleconsultation, first of all, and also to accept home sample collection. So you could take your sample, do a swab for you, and go and send the results to you. And also for some of the treatments that we normally use to have them done only in hospitals, they were able to be done in at the comfort of your home or your office and all that. I think a good example is vaccination. Before you had to go and get vaccinated at a healthcare accredited facility, but with COVID, they had to do it at the shop, retail shops, restaurants where there is space and all that. They set up tents, and this showed that actually there are certain services which can be uh, taken away from traditional healthcare settings, and they will increase actually uptake of, for example, preventive healthcare,
Mm.
vaccinations, as I've mentioned.
Fantastic. So, the way that you've described it, and what I read, this model is described as omni-channel. So it blends the
True,
in-person care,
true,
mobile clinics, and digital services. So for
true.
someone who has never experienced this before, what does this actually look like in practice? So if I'm a patient, can you walk me through that journey?
Yeah, so before I even talk about the hybrid model, I
Mm,
can give you an example of what Kenyans basically do, the day-to-day
yes.
Kenyans. So, given that our healthcare facilities are normally congested, and also the cost is quite high, I think you and I, when we are sick, you think you have a sore throat or headache, you just walk to the nearest pharmacy because they are over, I think 2,000 plus, I think 5,000 and something, according to the KMPDC. And these facilities, you walk in, you state your problem, and you're given some medication. And I think 70% of the time, you'll be able to sort your issue or at least postpone your visit to your doctor or something like that. So
Yeah.
this has been the normal practice for most Kenyans, and it is a problem.
Mm.
Simply because it is driving, for example, antibiotic resistance. And many of these pharmacies do not have a qualified farm technologist. Some of them just place a normal, I can call them a vendor or something like that, and their target is just to sell the medication, and they are not keen on doing diagnostics and stuff like that. So TIBU Health wanted to address one thing. And the first thing they wanted to address was the time. The reason why you visit this pharmacy and all that is that it takes less time for you to state your problem and to get at least some quick relief. Because
Yes.
I'll go to hospital because the headache is very severe. If I can take some Panadol today and maybe prolong it by a few hours, the better. So
Mm.
what we do in these situations is that when you walk into a pharmacy, we have our placards there with our toll-free number, and
Okay.
we encourage the pharmacist to probe you a little, like what ailments you have, do some kind of triage. And if he feels that you require some medication which requires a doctor's prescription, then he advises you to call that number. So you call our virtual number, you are connected to the doctor. They do some consultation for you. If your condition requires some tests, they can advise you where to go and do the test, like the nearest facility, or they can decide to do the home sample collection, and they can actually come to the pharmacy where you are, draw blood, go and do the whichever diagnostic that needs to be done and send the results over. Once that is done, also the doctor can write a prescription for you, which you can now fulfill at the pharmacy that you're at. And we've seen with that we avoid giving people unnecessary prescriptions because I believe most people, when they feel ill, they either say they have typhoid or malaria.
Mm.
Yeah. So, in short, that is our telehealth virtual consultation journey. I think you also know that TIBU Health has some clinics co-located within pharmacies, like, for example, Good Life. And in these instances, we do know that there are conditions that you cannot only do virtual consultation, you need to do some physical examination,
Mm.
and also you need to use some certain diagnostic gadgets to find out where the problem really is. So in this instance, when you go to the front and see the pharmacist, they will direct you to the consultation room, which is just next by. You see the doctor, they do the physical exam or whatever that is needed, and they can write the prescription or advise you also on which specialist to see if you require specialized care or any follow-up that you may require. They'll be able to do that for you. So I believe another challenge with most people when they're seeking care is they don't know whether their condition requires a certain diagnostic procedure or a certain specialist care and all that. And this seamless journey, because it is a hybrid model where we have, as you said, teleconsult, physical location, home-based services, and the virtual, which does the scheduling and follow-up.
Mm.
We're able to guide you step by step on what you require, including evacuation. Maybe you require an ambulance for your condition. And I think that way we are transforming healthcare and also decongesting the accident and emergencies. So we don't have to have everybody going to the major hospitals for care.
Oh, okay. No, I understand. I have a follow-up question. I'm just thinking, who, with the telemedicine side, who are they talking to? They are talking to a qualified doctor.
Yes, they are.
Okay. And then you have doctors, let's say, in your doctors on call who are specialized to act in the telemedicine side.
Yes, yes, correct. And we also have specialists. So, the beautiful thing with the virtual consultation is that we are able to disseminate and expand the outreach of specialities because majority of them are based in Nairobi. So I can give an example for a neurologist. If you are having convulsion disorders, which we normally call them fits as well. There's usually a certain test that you need support, which is supposed to be done, which is basically an EEG. And nowadays we have machines, which is just like a cap which you put on, and it can be operated by a nurse or just a nurse aide.
Okay.
And this data is transmitted into a mobile phone, and that data is sent now to the neurologist. And at the comfort of their office, they're able to read the report, write out whichever prescription that is needed, and send it over to you. So if you are at a pharmacy, I mean, that can be done for you. Same applies for ophthalmology. We have a very beautiful fundoscope, which can also do the same because basically it takes a picture.
Mm.
And I think nowadays with technology and mobile phones, we know how to take good pictures because the gadgets that we have nowadays can do autofocus. So you don't really not need to do a lot of skilled training for this. So I think um, our hybrid system is really, really doing wonders, and there is more to come.
Wow, I'm so impressed with the technological aspect that you have um, in the facilities that are available to the Kenyans and the community. So, how did you make sure that TIBU Health was actually tailored to Kenya's diverse socioeconomic and cultural realities? So, speak to me about that.
So I think when you have a startup, there are always challenges because
Mm,
what you think the patient wants is actually not what they want.
sure.
And whatever works for the American market is not what's going to work in the Kenyan market. So Tibu was founded by Dr. Sorry, not Doctor, but Jason Carmichael and Peter Gikera. Jason is in the field of public health, and Peter is an IT guru.
Okay.
So when they started during COVID times, they had this idea of having the mobile applications. So it was both on the Google Play and the Apple Store.
Mhm.
But uptake was not as great as they'd expected, or basically the usage. It
Mm,
was like at 20%. But the calls that were coming to Tibu were 100 plus. So they noted that as much as they would expect people to make orders through these applications, they were not using the applications as the apps as they should.
mm,
Number two, I think most people thought that video consults would work quite well.
yeah.
But then Kenyan market, people are very worried about data. I
Yeah.
think most people complain about Safaricom. You open your data and in 2 minutes you have insufficient
Finished.
funds and all that.
Yeah.
Yeah, exactly, exactly. So we also had to do away with that because I think there are many gadgets out there which are standalone. So we had the idea of placing them within the pharmacies, and
Mhm.
all the patient had to do was just go in, key in whatever, like the queue management system that we have in banks, and they're able to talk one-on-one with the doctor. But then we
Okay.
realized that the bandwidth for that is not there. So we
Mm,
had to really, really change the way we think about it. And that's why we came with a toll-free number. Something else also that we noted was during COVID time, people were forced to use telemedicine. So insurances before did not accept telemedicine, and people had to pay out of pocket. But during COVID times, a couple of them agreed to that, and they came up with systems like the OTP prompt, which is able to identify that actually it is the client who has initiated this consultation. But after COVID, the Kenyans no longer wanted virtual consultation. They were asking for physical locations.
They
And
wanted it.
that's why we had to come up with this hybrid model to be able to sort them out and give them what they want.
Mm. It's so
Yeah.
true. I think it's some of these things, like you said, that it might work in the US market, but once COVID is here, I know, let's say, for example, when I'm using the bank system, I reach a point where I'm like, I want to talk to a human. I crave that interaction, and I think at the core, we are designed for for interaction as much as this is designed to make things easier. So I'm
Mm.
happy to hear that you did think of these alternative solutions to counteract, data, the internet connectivity as well. So this toll-free number, is it 24/7 or has it got a specific window when you can speak to a doctor?
So it has a specific window, 8 a.m. to 8 p.m. And we came up with that simply because of we looked at data when patients call way often, and majority of the time they actually call in the afternoon, going towards the evening. Very few call during morning time. We would like actually to extend that time to 10 because we've also noted that from 8 to 10 there are still a few more dropped calls.
Mm.
But that one now we have to also coordinate with different partners because some pharmacies, yes, do work until late, others do work 24 hours. And I think we're going to adjust according to that. And given that we are going to go now outside Nairobi, like we are planning to go to Mombasa,
Mhm.
Narok, Kisumu and the like. I think there are cultural differences and even habits. So opening time would be different, for example. So I can give you an example. One of our minute clinics operates from 11 and then we close way later because
Mm.
8 to 11, nobody's going to walk in. Mombasa have been told that if we open a clinic within town, after 4 p.m., everybody disappears and goes outside the city.
Oh,
So, yeah, exactly. So we really need to adapt according to the community and how they live their life. I think also for some of them, you have to consider if they are Muslim, maybe it's
yes.
prayer time and the like. Yeah. So all those have to be taken into consideration and we have to tailor to each market.
Mm. And speaking of tailoring, I think what a key thing in healthcare, not only in rural areas or rural communities, is the issue of trust, right? Trust in medicine. So, what are some of the challenges, or how have you navigated, convincing people to embrace digital health as safe and reliable? There's a lot of talk with misinformation and fake news and deep fakes. So in this world, how are you convincing people that you're really talking to a doctor? For example, your data is safe. There's so many issues around that issue of digital health.
Yeah, and I agree with you. Actually, healthcare is a referral system. It's not like other products whereby you just put a billboard and people will start buying from you. I think we've had many instances whereby somebody walks into a clinic and they end up not walking out of that clinic because either the doctor was a quack doctor or they're practicing in spaces where they're not supposed to practice that condition. They don't have the emergency services to cater for the complications that can occur when they're doing those procedures and the like. So Kenyans are very skeptical about health. And as you say, even when you're doing the teleconsult, they want to know your credentials. Are you really a doctor? You know, and the like. And I think one thing about health, as I mentioned, it's a referral system. So if your mom tells you that TIBU is okay, you'd rather go to TIBU, yeah,
Yes.
than just looking for signage somewhere to decide where to seek your care and all that. So
Mm.
one of the ways that we've done so is actually by having health talks within corporate organizations, communities, residential areas. just to make them aware of the kind of services we have, the quality that we offer, and we even give them some free services so that they understand not only how good we are at doing it, but also how reliable we are
Mm.
in that aspect. Um, Something else also we've done is have proper feedback mechanisms because people always want to read and know. The same way, like for a B&B, you'll go and
Reviews.
read the reviews, yeah.
Yeah,
And if the reviews are good, you'll be like, yeah, let me go and give it a try. Yeah, so that
sure.
one has also helped us quite a lot because we are on all social platforms. And you cannot say that we are controlling that feedback because we are not the caretakers of that platform and all that. So that also helps a lot for people to start using our services. We also partner with insurances, so CIC, Old Mutual, and the like, and we offer this as an incentive or an extra for their clientele because we charge them way less than the normal fee for consultation. And I think this added package for their clientele also helps them in a way that we are able to redirect their clients to where they can seek care and without them worrying about the facility exhausting their insurance and all that. So that one has also built a lot of trust for TIBU teleconsultation.
I'd also like to understand the views from the doctors themselves. Have they been also receptive in embracing this form of technology? You mentioned, for example, that you are liaising with medical aids so that it's charged less. So does this mean that they won't be getting the same amount of returns? With this digital health. So how are the doctors actually taking this innovation?
At first, there were some reservations because, as you say, they were worried
Expected.
that they're not going to make as much as they used to in their
Yes.
physical locations and all that. So there was a bit of pushback, but after some time, they saw that actually virtual consultations build into getting referrals into physical locations. Because as I
Oh.
mentioned, there are certain conditions that you cannot manage virtually.
Mm.
And with this patient, if you didn't do the virtual consultation with them, you could have actually lost them because either they would have decided not to seek care or they would have gone to another facility for that kind of care. So slowly and slowly, they have started accepting virtual consultations. I think another challenge is training from med school. They used to tell us every patient you have to do a physical exam on them, and you have
Yes.
to spend a minimum of 15 minutes with them. And you see now this has been ingrained in every doctor. And now
Ah,
you're coming with technology and telling them that I can actually consult you over the phone and be able to sort you out. And something else also, patients do not, or they forget to mention everything. I think most of the time, for example, when you're having food poisoning, you're going to relate it to what you had last.
mm,
And yet, maybe what actually is causing that problem is something that you had 8 hours or 12 hours ago, because it
mm.
does take time to manifest. Yeah. So in that instance, that's where doctors like to do a physical exam because maybe somebody will forget to say that it's not only my hand which is hurting, but also my back.
Mm.
They'll mention the thing that hurts the most and not mention anything else. Then when you probe and do the physical exam, then you find out that, oh, actually, that's not the only problem. There are other issues which the patient thinks it is from some past occurrence or something like that, and they're not correlated.
My mom works in the health space. She's a nurse, and we have some of these conversations because I speak a lot about, digital health and whatnot. And one of the key things, as you're speaking about how patients fail to communicate to their symptoms, or rather, like how you're taught at medical school that you need to thoroughly investigate a person, is that we, as the lay people, we do not have the language to explain some of these things, right? I could think It's my hand that is sore, but it could be something to do with my back. I'm not sure. But so if I was in my doctor's room, I would be able he could do that 15-minute thorough examination, or I just don't have the words to explain some of the things that I'm feeling. So, do you not, is it maybe not like a problem where some things could be missed and fall through the cracks because we as a people are not equipped to really explain our symptoms, let alone diagnose it?
Yeah, I agree with you. It is a problem. And that's why TIBU had to come up with the hybrid model because no one solution works
Mm,
for everyone. And people are different, as you've mentioned. Some people can explain themselves clearly what they want and what condition they have. And for them, you don't need to do that physical exam because maybe it's a condition that they've been going through or experiencing for quite a while. And they even know maybe the medication that they need to be on. They just need a prescription because without a prescription, they cannot fulfill this thing. But with technology, the beautiful thing about it is that, first of all, we have an integrated patient EMR, medical management system, which is connected to the LIS, which is the lab management system, together with a dashboard for the patient. So, for example, if you are hypertensive, for example, and you came in, we took your pressures because I think most pharmacies nowadays are able to do those basic tests without
mm,
requiring a doctor to be there or a nurse. With that data, they can just key it in on the dashboard, and this also forms part of the consultation. Once that has been done, and maybe we've given you some initial medication, we always do a follow-up,
okay.
depending on the condition that you're having, because I know for a certain condition, I can give you 1 week for review. Another one, I can only give you a few 24 or 12 hours before I do a follow-up because of the risk that we might have missed something very important. And also the fact that maybe you might end up requiring to come physically to the location. So all this has been mapped in a very nice algorithm, which we train not only the medical personnel because they already know about that, but also all the farm technologists and the pharmacists so that they're able to ensure that very little is missed out and follow-ups are done to ensure that whatever management that was shared with the patient is working and we have not caused harm to the patient.
No, I'm impressed that there are some workarounds to some of these solutions. And of course, some things cannot happen immediately and it takes time to develop. So earlier on, you told me that you are thinking of introducing TIBU Health to other parts of Kenya. And I think this is obviously an innovation that would be great if it's, to be scaled even across Africa because many of these issues are African problems, even world global problems. But for now, let's focus on our 54 countries. So, what does it take to scale this model? Do you need partnerships with local governments, funders, tech companies? What is the way around to make this accessible to so many people so that people can thrive using innovations like TIBU Health?
As you mentioned, this is a challenge and not only a reserve of African countries. And I believe Tibu's model is something that can really work well in Africa.
Mm,
Right now, we're in Kenya. We are partnered with the Good Life, but we want to enter other retail spaces like supermarkets. We are in active conversations with them. And for these minute clinics, as we call them, some of them will be subspecialized. So basically offering vaccines. If you walk in there, you're going to get your vaccination and certain basic procedures like removing of earwax, and the like, because for those ones, you don't need to really go to a big healthcare facility and all that. And we do need partners because we want to bring down the cost of healthcare. And the beautiful thing about setting up in in pharmacies and retail spaces is that we share the cost. So
Mm,
cost for rent, cost for utilities and all that, it is shared.
brilliant. Mm,
And shared in a way that we do a revenue share, not that we pay part of the rent, because we benefit from their footfall because we already set up these mini clinics in areas where there's already a high footfall and easily accessible to a certain residential area or school or community. And doing so, we do not have to spend not only on utilities, but also on marketing and many other things that we normally do. And we're able to pass on these benefits to the patient. So, for example, our flagship clinics, consultation fee will range between 15 to 5,000. For a minute clinic, it will range between 500 to 1,000. A lab test, for example, like a hematology test, will cost half the price that you'll normally pay at our flagship clinic, and even over 60% less than what you normally pay in the other facilities. And this is the benefit of this low cost setup model that we have. The fact that also we use insurance companies, we have over 27 insurance companies, and they also refer their clients to these minute clinics, also advise them to use the virtual consultations and the like. We're also able to pass these benefits of um, low cost uh, consultations and medical services. So it's a very beautiful model. Good Life is in Uganda.
mhm.
Currently in Kenya, they have, I think, 145 pharmacies. We are there across those 145 with virtual consultations. We also will offer virtual consultations in Uganda because I think they have, I think, 6 to 10 units over there. So we are going
Okay.
to get a toll-free number, and God willing, given we have angel investors and our current investors, we will be able to go to Uganda and beyond.
Amazing. It's such brilliant work. I love the idea of being in supermarkets or retail areas, as you call them, because that's where people already are. And it brings in that added convenience that I don't have to go, I can get my shopping done and also see the doctor at the same time. So I really hope that this innovation really goes beyond and reaches a scale that it needs to, because so many people can really benefit from this. And Dr. Carr, I've thoroughly enjoyed this conversation. As we close off, I have a big question for you. If you're sitting here 10 years from now, what's the dream that you have for healthcare access in Kenya and even, across Africa?
The first thing I miss about how healthcare was before,
Mm,
after independence, for example, is the emergency number, 991, 999 or something like that. Because currently healthcare is disintegrated. Every facility does their own thing. Every facility has their own EMR system. And so if you're transferred from one facility to another, it takes time for you to get those records from facility A to facility B. So
mm,
my first wish should be to have a centralized system, which would be make it easy for facilities to transfer information. And number two, also to have kind of a web-based dashboard, because one of the challenges that patients have is they come to your facility and you ask them, which medication are you on? It's a green pill, it is round, and stuff like that.
mm,
If
yes.
they can access this information online and just show you that I was on this medication before, then I got to this medication. These are the tests that have been doing so far. These are the results that I have and all that. It would be beautiful because it would mean that you can easily seek a second opinion. And also, when you're outside the country, you can still access your information and get the treatment that you need. So I believe if all healthcare facilities embrace technology, we are going to move very far, and that includes government facilities, because one thing I always notice is that many private healthcare facilities are not in certain towns, but as Kenyans, you visit everywhere. You can have an accident somewhere, and the people that don't have your information that you're insured and all that, and you end up at Kenyatta or, and the like. So I really hope that we can ensure that both private and public healthcare facilities have quality healthcare. They are well equipped and also have well-trained personnel and properly staffed.
What a wonderful vision, and it's one that I also fully support. And I hope, in 10 years' time, when we come back and TIBU Health is all across Africa, we can remember this and look,
for sure.
and it
For
has
sure.
it has happened. Dr.
Yeah.
Karl, thank you so much for sharing the journey of TIBU Health and really showing us how compassion and innovation and technology can bring healthcare closer to people. This has been such an inspiring conversation.
Thank you. I've really enjoyed it, and I look forward to having another one, maybe in 10 years' time or even in 2 years' time. Yeah.
Definitely. And to everybody else who's tuned into this episode, thank you so much for listening to another episode with your girl, Anne with an E. Until next time, goodbye.